Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Welcome to Fronteras, a changing America. I'm Jonny Coker. Last week, New Mexico's legislative session ended in a matter of hours after months of debate on how best to address public safety from a policy perspective. After the abrupt end to the session, Governor Michelle Lujan Grisham issued a statement calling the session one of the most disappointing days of her career. Quote, "This legislature just demonstrated that it has no interest in making New Mexico safer. Not one public safety measure was considered. Not one, despite the bills having the backing of police chiefs, public safety unions, mayors, prosecutors, businesses, tribal leaders, crime victims, and others who have seen firsthand the erosion of public safety that has deeply damaged the quality of life in our state." Joining me to talk about this and other important issues facing New Mexicans is Kat Sánchez, Policy Director at Bold Futures. Kat, thanks so much for being with us today.
Thank you, Jonny, for having me.
Definitely.
Appreciate the opportunity.
Oh, definitely. And, we'll definitely get into Bold Futures and the broader work that you do, but I wanted to start out by asking, what was your take on the special legislative session? It started and ended so quickly. Is that something that you expected or that others around you expected? What was your takeaway?
I don't know that there's anything that you can expect really when it comes to a special session. They have rules of their own, and the rules of engagement do change. It was, I think, pretty much from gavel to gavel, 5 hours, from 12 to nearly 5 p.m. And Bold Futures was up there because we firmly believed that some of the legislation that the governor had was incomplete. We needed to hear a little bit more from mental health providers and those who are directly impacted by some of the legislative proposals that she had. And we do appreciate that the governor has brought this forward and has really lit a fire, and I believe that was Senator Stewart's words, lit a fire under the legislature to tackle these pieces. We do think, though, that it needs to be vetted thoroughly in a 60-day and bringing more people to the table.
And Kat, the ACL of New Mexico, as well as Bold Futures, dozens of other organizations signed an open letter to the governor calling for a stop to the session just a few weeks before it started, citing legislation related to civil commitment, competency, and median safety. Those were the main concerns with this session, at least according to the ACLU. So what is your take on that? What is your take on those bills that, target civil commitment, competency, and median safety?
Again, Jonny, I think for civil commitment and competency, we really do need to have the people who deal directly with patients and clients on this, and that's the mental health providers. What we've heard from our conversations with mental health providers is that this could be abused easily in the system because this doesn't give, or the legislation as proposed did not give an opportunity for DAs to make decisions for themselves or for their counties about individuals. It was mandating individuals who were not found competent to start the process of involuntary commitment. And that can be easily abused, is what we had heard from healthcare providers, mental health care providers, specifically here in southern New Mexico. And we agree with the ACLU. That's why we also helped pen the letter, sign on the letter, and showed up. Not just to legislative session, we showed up and have been showing up to the CCJ interim committee hearings, just to ensure that those voices and voices of our community leaders are heard.
Sure. And so, what is the conversations that you're having with those mental health providers and organizations surrounding this issue? This has been such a fast and furious legislative session, but what is the hope moving forward? Like, what is the best way to tackle both of those issues as we, move toward the 60-day session that's going to be happening early next year?
I think part of what needs to continue to happen, there was a committee with the state Supreme Court that was working on these issues. They need to finish their job, right, and giving some their expertise in how to handle some of these issues. And we need to continue the conversation. And we've heard from legislators that they are still wanting to. They have an appetite for revising the laws and we agree, some of these laws do need to be revised. However, pushing them through without, and again, mental health provider input and people who are impacted, that's not helpful. So we hope and we want to be at the table and continue these conversations to make this piece of legislation the best that it possibly can to help all aspects of New Mexico.
And what are your thoughts on bills related to median safety? And I know the city of Las Cruces is going to be having its own vote on an ordinance upcoming soon, speaking about shopping carts, like increasing penalties for individuals that are in possession of stolen shopping carts. What are your thoughts on that type of legislation? Do you think that's something that is to be considered at all?
I would say fairly that all legislation that is put forward needs to be considered, right, in its own time, in its own place. And that's what the legislative process, either the 30 or 60, is for. And honestly, the tragedies that happened in Otero County with the fires and the flooding have left many people without a home, many people carrying the only things that they have. And that to us is an indicator that we are one devastating life event away from just having to carry all of our belongings with us. The reality is that taking shopping carts from stores is already illegal. Putting any extra mandatory minimums or any extra time and criminalizing those individuals, that doesn't do anything to solve the issue. Just because we may not like to see that, and that's the reality, these legislative proposals, either at the local or at the state level, is because these aren't something that we like to see. And we shouldn't be criminalizing poverty. That's terrible policy. What we should be doing is offering resources to those individuals who need it. Because again, what we saw in Otero County is we are all of us, one devastating life event away from being in that situation. And what we need is compassion, just like what the legislature showed to residents of Otero County in the HB1 feed bill.
Mm-hmm. And I'm glad you brought that up, HB1, because and also in addition to giving funds to Otero County and Lincoln County and affected individuals in those Lincoln National Forest wildfires, there was $3 million appropriated to assist outpatient treatment programs and competency and diversion pilot programs within the state. I was wondering, with that being the sole bill that passed through during the session, what are your thoughts on that?
So many years ago, Senator Papin, I believe it was, who had championed the AOT movement across the state, that didn't at the time have funding to go with it. So there's exactly one county out of 33 in New Mexico that has an AOT program, and that's in Doña Ana County. And that is funded by our county, not by the state funds. So making sure that we have some funding towards that is probably one of the best things that we can do. Otherwise, we would have legislation that goes and mandates across the state, but doesn't have any funding to back it, and therefore no resources or infrastructure. So adding that to the funding bill is one of the best things that legislators could have done.
And so, this session, it was a controversial session in that I know the governor didn't get everything done that she wanted to get done, and Democrats were generally opposed to it, and there were Republicans carrying the bill for our Democratic governor. So, from the public's perspective, maybe an outsider's perspective, it seemed a bit messy. But do you think that this session was productive in that, in advancing the conversation for New Mexicans about that public safety conversation, about the best way to move forward into the future?
The first thing I'd say, Jonny, is that policy making legislation is always messy. There is no such thing as a perfect bill. And so we knew that going into a special session, it was going to be different. It was going to have its own set of circumstances. And like you said, it was going to be a little bit messy, but all lawmaking is, right? Most people would not be talking about outreach or treatment facilities, resources, infrastructure, mental health care like we are now. And part of changing laws is to be able to have the culture shift to make sure that the laws are in place. So you have to start those conversations in order for our legislation to be passed. So regardless of who was carrying the bills, what the outcome was, the most important thing is that we started these conversations, because people are now talking about the best way to get the care, not just for themselves, but for other folks. And we're seeing the humanity and dignity of people who are experiencing homelessness, people who need desperately to have mental health care. And we are once again trying to focus on having providers in places that are most needed, because we know that the state has a severe lack of providers. So this conversation is ongoing, it's important. And so the outcome of the legislative session, the special session, was incredibly important towards that end.
And so do you think that, the conversations around public safety in New Mexico definitely seem to revolve around putting in more infrastructure and emphasis on funding in terms of mental health resources, in terms of addiction counseling, things like this, rather than going after the symptoms of public safety, going after the root causes and trying to basically inject more funding and inject more resources so that more providers come to the state and so that individuals seeking help and housing have that available to them. Would you agree with that?
So if I understand, Jonny, you're saying that we currently are not putting as much resources, and this is a product of us being able to?
Well, when I've spoken to individuals in this field, like providers in the field, I think what they're asking for is more resources and more funding rather than criminalizing or stigmatizing. So is that something that you would agree with, I suppose?
Most definitely would agree with. Absolutely.
Yeah. And so how do we advance that then? How do we advance, there is a clear lack of healthcare resources in New Mexico, mental health resources, and a severe lack of housing. So how do we get that done from a policy perspective to get that type of funding to New Mexico, in one of the poorest states, and in southern New Mexico in one of the poorest parts of one of the poorest states in the entire union?
For sure. So, Jonny, I think that to be able to tackle a complex issue just like ending homelessness or more resources towards mental health care, it's going to take a lot of different pieces of legislation. One's just not going to be enough. Two is not going to be enough. There are so many reasons why individuals end up homeless. There are so many reasons why people can't get access to the care that they need. So we need more than just resources in terms of providers. That's kind of a simple answer to say, like, we want to invest in providers. We also have to look at how we can help people who are coming out of secondary institutions like NMSU, like UNM, how we can keep them here. So what we can do for student loan debt, that's one of the ways we can do it. There has been legislation over at least the last 7 years on rural healthcare provider tax credits. So providers who are living and working in rural communities getting a tax credit for taking care of those communities that they're from. Typically, they do not pass, but again, that's one other piece of legislation that can work towards that end. In terms of homelessness, and again, there's many different ways to attack a complex issue such as homelessness. What we've been talking to some of the community leaders, and in particular the executive director from Community of Hope here in Las Cruces, is about housing vouchers and the way that they are used and how we can make them most useful for the people who have them. What we've heard is that there are fees that are associated with renting properties that the vouchers don't cover. And so if we can limit those fees, that might best be able to let folks who have the vouchers be able to get into housing that they can have. So to answer your question, there's so many different ways. One or two pieces of legislation isn't going to do it alone, and we have to work together as a community. And again, I can't underline enough just how much the governor's start of this conversation is helpful. We don't want to say that we don't need another special session. We're not saying that this isn't important. What we're saying that it is so important that we need to take our time, have all of the stakeholders at the table and ensure that we have solutions that are going to be long lasting for all New Mexicans down generations, not just now.
And Kat, you mentioned the Community of Hope, the executive director there, Nicole Martinez, of course. She was on our show within the last few weeks. But what other organizations do you work with, specifically in southern New Mexico? Who do you collaborate with in order to push this conversation forward?
Our biggest and most beloved collaborators are our community leaders. We want to invest in the folks who are most impacted by these issues. So we have touchstone groups that we work and learn from. They help us understand some of the bills. They go to session with us. So that's our number one collaborator. In terms of other organizations around the state, we do work with Equality New Mexico, the LGBTQ organization, of course, the ACLU of New Mexico, the Center for Law and Poverty, Southwest Women's Law Center, and they are statewide organizations that represent all of New Mexico. In southern New Mexico, there are some advocates that we work very closely with from the ACLU down here, and we work with CAFE down here. So we're trying to expand the folks that we have been working with, and so that we're not just an Albuquerque or Santa Fe organization. We truly are trying to be all of New Mexico.
And how important is it to have that sort of representation and to have that that reach in southern New Mexico? Because I feel like in my reporting especially, some folks feel that there is a divide there between Bernalillo County and the Santa Fe counties, and then the money sort of trickling down from our state's capital and maybe not making it to southern New Mexico as much as some folks would like. So how important is it to have that sort of reach and that representation, I suppose?
It's important enough that an organization that is now celebrating its 25th year, Bold Futures, which started in Albuquerque, made an intentional decision about 7 years ago to open up an office down south. And it's important to get the perspective, not just from Las Cruces, because Las Cruces itself is just one part of Doña Ana County, which is largely rural. It's important to get those perspectives, to get the rural perspective, the frontier perspective. Our border region is vastly different than other parts of the state. A lot of our folks are very fluid with going to El Paso for healthcare, for food, for all of those things, because geographically it's closer. Our family is still in Texas. So it's so important to get that perspective from down south, because we are incredibly different and incredibly important and incredibly beautiful.
Definitely. And Kat, I know we spent a lot of this discussion on public safety and on the housing crisis, but I also, I wanted to talk about Bold Futures a little more broadly before we wrap up. So Can you just give me an idea? Y'all do have a really broad scope of what you do across the entire state, like you just mentioned. So do you want to just give a brief overview of that work that y'all do beyond public safety and, the conversations revolving around that?
Yeah, no problem. So Bold Futures is a statewide reproductive justice organization that is created under the framework that was made in the mid-90s by Black women and organizations across the country. And the framework itself basically is whether or not to have kids, to delay, if need be, the start of your family, and to raise our families, whether it's with or without children, in safe and sustainable environments. And it's that last part of the reproductive justice framework that is incredibly intersectional with other justice movements like environmental justice, criminal legal reform, child welfare, so on and so forth. Most people really do think of reproductive justice with blinders on, only from a healthcare perspective. And the justice movement is more than just access to healthcare, although that is an incredibly important component of it. Bold Futures moves its work in a couple different ways. Obviously, legislative, we have built our relationships over the last 2+ decades to be able to bring folks to the table. And that's the second way that we move our work, is that organizing, is the investment in leaders. We don't necessarily want a list of 500 names. We want to invest in individuals who will advocate for themselves, advocate for their communities, advocate for their families. We do culture shift work. And what that looks like, as I kind of alluded to earlier, was sometimes you have to start or change the conversations before even policy can be changed. And a great example of that is we made a movie. We took some stories from women who are either parenting or pregnant and in cycles of substance use, and threaded their stories together to create a full-length feature film called All the World is Sleeping. And that culture shift is showing the perspective of someone who is pregnant and dealing with the cycle of substance use, and the realities of that. And then the last way we move our work is research. And so we're looking less at numbers and more at things like how midwives and doulas help the mortality, morbidity rate in not just in New Mexico, but across the nation. We're looking at young families and how much they contribute to our communities. So that's the kind of research that we invest in.
Definitely. And
so that is incredibly broad, Jonny. So
no, and that I'm sure there's a lot that we can dive into in what you just talked about. But I did want to talk about some of the research that jumped out to me was the benefits of licensed midwifery and community birth in New Mexico among Black, Indigenous, and people of color families. I mean, tell me about this project specifically. And this is something that I wasn't, it's something that I feel like maybe a lot of people haven't thought of is, how important, midwifery might be, especially in rural areas and underserved communities. So can you just speak to that a little bit?
Sure. Well, Black and Brown communities have had such a rich history of catching babies without needing to go to a hospital, right? And having a midwife there to do it is more personal. This is not to negate the role that OBGYN or labor and delivery in hospitals and other institutions play, because they are incredibly important, especially if there are complications in pregnancy. But what we do know is that, as you mentioned, in rural communities, not everyone has a hospital, not every county or community has an OBGYN, and midwives and doulas play such an important role for the advocacy of the parent, the family, what they need in the process, not just in labor, but throughout the pregnancy and even after, including lactation consultants, because it's not as easy as it seems to have your child latch on right after birth. So these, not only is there a rich history, these midwives, these doulas, birth keepers, they play such an important role in our rural communities that their part in it can't be understated. It's part of the reason why we advocated for and have been helping with rule changes around Medicaid covering not just certified nurse midwives, but licensed midwives, as well as doulas and lactation consultants.
And Kat, we don't have a ton of time left, but we are just a little over 2 years since the overturning of Roe v. Wade, and we've seen the waves across our country, how that's affected organizations. But how has that affected Bold Futures broadly?
Sure. So, Jonny, we're not a direct service provider. We are primarily an advocacy and organizing organization. So the ways that it has impacted us is making sure that we have our communities know that New Mexico is still a place where folks can get the access to the care that they need. We've been seeing people from other states coming to New Mexico for that care, not just since Dobbs. We have been seeing that the access to care has been slowly chipped away over the years. And one of the biggest projects that we worked on, the Reproductive Healthcare Success Project, was hearing from communities in 3 different counties to see what gaps in care that they had. And this project started before the overturning of Roe. And we did that because we knew the writing on the wall. It's a successful project with UNM, with Strong Families New Mexico, as well as Planned Parenthood. And that's leading to our community or healthcare center that's going to be in southern New Mexico. And we're incredibly proud that collaboration, the first of its kind in the state, that has so much community input, that it's going to be in our own backyard.
And is there a timeline on when that clinic might be open by chance? Do we know that yet?
Don't know that just yet.
Okay. Well, before we wrap up, I just wanted to ask Kat, Where can individuals find educational resources, services, whether it's related to reproductive care or anything else that Bold Futures touches?
Sure. You can find us online on the web, boldfuturesnm.org. We're also on Instagram and Facebook for kind of faster updates to what's going on in the work that we're doing, the leaders that we're working with.
Well, this has been a really enlightening conversation, Kat, so I appreciate you taking the time out of your day to talk with us and to help educate our audience, and it's been a pleasure having you on today.
Jonny, the pleasure was mine. We love KRWG. We love the voice that it has for our community, and anytime you want us back, we'll be on.
Of course, yeah, we'll have to get you in studio next time for sure, so thanks so much for being here. That's all for today's episode. Remember, you can stay up to date on the latest local news at krwg.org. For KRWG Public Media, I'm Jonny Coker, and we'll see you next time on Fronteras, A Changing America.